A bad fall can set our elderly loved ones up for months or even years of straight decline when it comes to their health. Dr. Greg Silverman joins us now. This is one of the leading causes of death for
no
seniors.
question that it's about 20% of all falls lead to death ultimately, and there's lots of ways that we can prepare and make sure that the chance of falls are less. And in addition to that, when you break something, the prevention of the break is very important as well. And that's what I'd like to talk about today.
So it's just a matter of setting up the house, the surroundings, so that there's not obstacles in the way to really.
Correct. Stop all the clutter. Get rid of all the clutter, because it's that people trip over. Get rid of any wet spots. That is, make sure that there's nothing out there that you can slip on. Make sure that the clothing fits appropriately. You don't want really baggy clothing out there, and basically everything on one level. Now, the prevention of breaks is a different deal. There was recently an article that came out about the prevention between vitamin D versus exercise. And as it turns out, that exercise is better for preventing breaks during a fall or after a fall than vitamin D. So it's really activity. You got to stay mobile. You got to stay active.
So does that mean seniors, anybody over 65 maybe, just routinely walking, doing some push-ups or stretching?
Correct. All that stuff. It's really about functional abilities, and that is, you know, an elderly person, somebody like me, is not going to bulk up. We're not going to do that. Having said that, there needs to be a functional ability. That is stretching, aerobic capacities, walking, those kind of things. As it turns out, that just gardening is as good as weightlifting in the elderly. So, you know, the things that you have to do to garden, lift things up, move things around, lean over, keep active, those kind of things, that's very important. And it's very important that as you get older, you maintain that functionality.
That's the thing. You hear time and time again that, well, they were in great health until they fell and they just could not recover.
Correct. And it happens very frequently. And that's what we're talking about today, is the ability to recover from any subsequent problems, the ability to recover from any subsequent falls.
You feel that we'll be seeing more of this because with the number of baby boomers that are coming into their
we see it all the time. Fractured hips, fractured knees, fractured everything. And how do you recover from that? And that's important.
Dr. Silverman, we appreciate it.
Well, thank you very much.
Okay.